Good afternoon, everybody. Uh, so I will just put out my presentation. And what I'm going to talk today is essentially, I'm going to talk about what is the current scenario in India with COVID waste and what are the challenges with it and what is the kind of complexity that we are facing with this COVID waste. Uh, Sorry, okay. Uh, Start with, I think, as COVID started all over, all the countries, starting from Wuhan to Manila to everybody else, to Melbourne and other countries, everyone has started to report very high generation of waste, all kinds. And there was an apprehension that it's going to be plastic, which is going to be everywhere. I think that was one major apprehension, that plastic is going to be everywhere. And I think we are going to be flooded in the rivers, in the oceans, and we are finding it. So we don't know the real story as to where are we in terms of plastic waste and this COVID. In India too, I think as the COVID spread happened in March, we got apprehensive about it, about what is the quantum of waste, how it is going to be managed, are we ready for it, do we have the necessary infrastructure, do we have the training, do we have the capacity to deal with it. I think these were all the questions which were there in the mind of all of us, and that is what I would like to, as we go along and see how it happens, what has happened to it. And one of the major concerns that everybody was talking about or sharing was this issue of mask and gloves, which everyone had to wear and move around, which is a new normal today. How are people going to dispose it of, and what is going to happen to it? To be honest with you, even today, people do not know in this country how to dispose of their mask and gloves. We are actually don't have that clarity as of today. So, and we see that infectious waste is being mixed with solid waste. You find newspapers, as Ravi mentioned it, newspaper stories covering biomedical waste and COVID waste in, in every city. It is becoming a point of concern. You're finding it all over the place. Well, India, we had COVID as on first COVID case was on 30th of January, and it was Kerala from where we have one speaker, and today we have a cumulative total of 4,300,000 or 4 million cases that we have. So the amount of waste that it has generated, we need to really assess as to what happened, and I'm sure that CPCB will have some data. But just to give you a glimpse of what I was saying, just look at these visuals, and then you will see what is the story about COVID waste. What you are seeing on the left is one picture from Bangalore. Both pictures are from Karnataka. Both the visuals are from Karnataka. One is over the flyover, and one is in this barrel that you're saying people are dumping there. It is mostly that you're seeing is PPEs that you're finding it is being dumped on the streets. And it's a normal kind of a scenario. You'll find that they're being burnt also in heaps behind the hospitals. So this is something, this visual that you're seeing on the left are bags. This is from Delhi. And you find workers rummaging through it and trying to find something. And on the right, the picture that you see is from a hospital. This is Nair Hospital, Mumbai, where it's a big hospital, it's a government hospital, Nair Hospital. Look at the quantum of waste which has been accumulated there, and there are all kinds of stories about it. So this is one story that we hear on a daily basis, and this is being reported in the newspapers, and we don't know. And you would hear another story is that the waste is being managed adequately well. So we need to actually find out as to what is happening. Some facts about COVID, and these are some data. This happened on the intervention of the courts. Actually, the courts also took notice about this waste generation. That was in the month of May, that the court did intervene and asked the regulators to come forward and explain as to what was happening on this COVID management and how well it was being managed and what else they needed to do. But just to go through this data very quickly, you see the number of quarantine centers that came up all of a sudden because this additional number of cases that had to be handled. So we had in this country about 20,000 additional centers which were not trained, which didn't know about biomedical waste management, but they were new entities that came up. Sample collection centers, they were again new entities. They didn't know what protocol to follow, how to do it. So was the training adequate? Did it happen or not? So these were some new agencies that happened during this course of COVID. But pre-COVID, the amount of biomedical waste which the country was generating was 609 metric tons in total across the country. And now, after the COVID, the report that CPCB submitted on 31 May, they said that as on that date, they had 101 metric ton additional COVID waste. This was being termed as specifically COVID waste. So across the country, we had about 101 metric ton of additional waste that was being generated. So this is the total quantity of waste that was happening. So, but if you look at 101 metric ton, it doesn't sound overwhelming. It doesn't sound that, you know, from 609, you just went to about 710. So did it really overwhelm the facilities? Was it too much to handle? So something that we need to talk about it. So the country has an incineration capacity of about 804 metric tons. And as per the CPCB details, they say that about 55% of this incineration capacity has already been utilized, but they have residual incineration capacity. But the question that I would like to throw up here is that why do we talk only about the incineration capacity? Why are we not talking about other kinds of capacities that a centralized facility has? But then this becomes evident in most conversation that what is the incineration capacity of the country? I think I leave that question for Jorge also to talk about as to why incineration is the most talked about or most spoken about technology in most conversations. We have states that don't have facility, centralized or common treatment facility, and there are 7 of them in this country. So actually that must be a point of concern for everyone as to how they're managing their waste in these 7 states. So the only process or the methodology or the protocol which has been given to them is deep burial process. I'm not too sure with this increasing population in these 7 states, and there must be towns and cities, how they're managing these kinds of waste, which is highly infectious. So this is something that perhaps we will uncover during the conversations with other speakers also. So I told you that NGT expressed the need to, you know, subsequently expressed the need for revising these guidelines. The CPCB came up with these guidelines in March to deal with COVID waste. This was an additional guideline which was further to the biomedical waste regulations that these COVID guidelines were issued. So uploading of data by municipal bodies and CPCB regarding generation and disposal of biomedical waste from residences and quarantine centers on an app. The NGT or the National Green Tribunal gave directions for creation of an app by the Central Pollution Control Board where everybody could upload the data on COVID waste so that we could have a we could monitor this and we could have a document as to we could know what is the total quantity of waste was being generated. And the NGT also gave a separate direction that for the State Pollution Control Board and the Central Pollution Control Board, this COVID services will be, their services will be essential services, and it has different kinds of connotation when we say essential services. Now, I just like to, at this point of time, we talked about what is the kind of problems that you're seeing excess generation of waste. You're seeing that waste is being dumped on roadsides, on open spaces, on municipal dumps. But I have some data about the city of Delhi, and I like to share that data with all of you and show you the trend as to what is happening in the city of Delhi. And I also have data from another city, which is the city of Surat. And this is the city of Delhi. You can look at this graph. It essentially tells you the graph that you see in blue bars is about regular biomedical waste, which was being generated as a normal this thing. And you have the orange bar, which represents the COVID waste. So look at it, and we have plotted it from March, April, May, June, 4 months, because March was the time when Delhi had a very small number of cases. I do have figures for January, but I'm not showing it here. So if you look at March and then April, May, June, you look at normal biomedical waste, which is in blue, it is decreasing. It is decreasing significantly. It's reducing. Each month on a month, it is reducing. And if you notice the orange bars for COVID waste, it starts to increase from March, and look at April, May, June. So as number of cases are moving, going up, this is going up. And as biomedical waste is coming down. Now, this is interesting that we had a decrease in the total generation of normal biomedical waste. And I will try and explain the reason for it, but I'll just go to the same data once again. This is the data in detail for Delhi from January to June for 6 months. Now, I've given you 2 more months, which is prior to the onset of COVID. January and February, we didn't have COVID in this country. And I am slightly this thing to see this data. If you look at on the right-hand side, on the total waste data, if you look at the total waste generation in January is about 840 metric tons. Total waste in Delhi, which has about 56,000 bed strength. In Delhi, we have about 56,000 bed, and the total waste generated, inclusive, it is about just biomedical waste, it was about 840 metric tons. And if you look at today, that was monthly data. If you look at today, in the month of June, we have about 900 plus data. I'm sorry, discovered here, but it is about 900 plus metric tons. So if you see, it has gone up by about 100 metric tons. This is biomedical waste plus COVID waste. It goes up to 100 metric tons for 1 month. So essentially what is happening is that we have an increase in total waste generation on a daily basis for about 3 metric tons. For a city like Delhi, which has got a bed capacity of about 56,000 beds and a population of about 18 million. So 18 million population, 55,000 beds, and you have an increased load of about 3 metric tons per day. This is the figure that I have, which we have collated from the facilities that are operating in Delhi. And by and large, this figure should be true and accurate to the best of my knowledge, because I picked it up from the facilities who are collecting the waste in the whole of the city of Delhi. It is not NCR, it is only the city of Delhi. So this is something important to see, that it is just about an increase of about 3 metric tons per day, which is happening in the case of Delhi. And if you look at the figure of Central Pollution Control Board as on 31st May, that also says about 101 metric ton per month, per day. It is increased. So that also tells you that it is increasing for every state. If you take an average, it's about 3 metric tons there also. On a daily basis, it is increased by that much. If I just compare this data about this excess waste generation to what is the capacity of these plants to treat this. If you look at this data, there are 2 different plants which we have in the city. One is SMS and the other is Biotic. These are 2 plants. And if you look at what capacity they can handle, they have the maximum that it has gone up in the month of April and May. It has gone up to about 70–75%, and then it's again come down to about 70%. So, you know, the capacity utilization for both these plants is about, one of the plants is reached to about 70%, whereas the other plant is about 50% capacity. So it is at this capacity that these 2 plants are operating. So it is interesting to see that you still have a residual capacity left with both these facilities to treat additional waste in case there is generation of it. So it gives you a sense of where are we in terms of infrastructure and in terms of what is the quantum of waste, especially that are being collected from dedicated centers which are known, which have been notified and which are identified. I do not say that the waste is not being generated from homes. That is another story, because I think Ravi also mentioned there's a lot of healthcare, lot of people who are COVID positive or asymptomatic were being asked to be at home, and they would also be generating additional waste. So this may not represent that waste, but this does represent quarantine center. It does represent your testing centers and all other new centers. So this was the data for Delhi, and I thought that it will make a lot of sense to people to unearth some of the about how the waste generation is happening across. If you look at the city of Surat, which we picked up another city, and if you look at them as to how the waste generation patterns have changed or have been followed over the month of March, April, May, and June, you'll see again here that biomedical waste, which is blue bars again, it has dropped. Again, a very significant drop in biomedical waste generation. And if you look at the orange bar, it is a significant, is rising gradually, and there is a rise because if the number of cases go up. I haven't plotted that with the number of cases, but just wanted to give a sense that this is how it has also risen. So I think the trends in both the cities, if you look at, for biomedical waste is about a decreasing trend, and for the COVID waste is an increasing trend. And why it has happened, I think one of the reasons that comes to our mind or when we're trying to analyze is that the country had a very severe lockdown condition where movements were stopped in the month of March, and most hospitals are, most patients were not able to seek medical help for normal illnesses other than COVID. And that stopped, or that placed a huge amount of restriction on people to visit hospitals. And most hospitals, I've also spoken to some of the CATF operators who are collecting this waste, and they say there is no generation of biomedical waste because there are no patients in the hospital. The occupancy rate came down to about 25% for normal sickness or illness, and only emergency cases were going to the hospital. So this is perhaps one of the reasons why biomedical waste came down and this waste has gone up. And so, but then the total waste that I was talking about is still about this very small rise in the normal. If you add up both this waste, COVID waste and biomedical waste, it has gone up by a small proportion. Now in the month of June, July, it is crossing that original figures of January and February, which we're having. So that is an additional increase. So I was just trying to understand what is the ground reality, what's the ground sense, because you are getting another one sense of data, which is telling you this story, another sense of data, which is telling you that waste is being strewn all over the place, it is being burnt, it is being thrown in rivers. So what is the real story, or where does it lie? Is it something which is in between both of them? So I think one of the issues that we found that there is improper segregation of waste, and that is leading to huge generation of mixed waste that was happening in the beginning. But with the revised guidelines that the CPCB gave, I think the segregation is improved. And that is why I think there is a bit of improvement in waste management scenario at the common treatment facilities. I think another issue that came up, and that was lack of preparedness for the pandemic. I think this is very, very important to say that, we never had any training, any guideline, any preparedness for this kind of an epidemic, or for this kind of a pandemic. So this was a huge, it happened all of a sudden, and then we had to move in and try and cover ground, and that gave an initial shock, and that was a problem to adjust. And that is why a lot of waste was going for incineration in the beginning, which I think my colleague from the CPCB will cover. Inadequate information and awareness, I think that continues even today. We do not know actually what to do, how to sanitize our homes if you have a COVID patient, how to treat with the clothes or belongings, how to treat the utensils. We have absolutely no idea how to dispose of the waste from domestic homes, and how the urban local bodies are supposed to do it. They have been told that, I think the guideline covers something about it, but actually, is it being implemented or not, or what is happening to it? That is a big concern. Record keeping of waste, we don't know how this record is being kept and where are these records. I think this is something that we need to unearth. Deficiency of PPE, I think this I will cover slightly later. Inadequate regulatory capacity, this is something that we all face, and we have been facing for quite some time, even when the regular biomedical waste generation was happening, that even if this waste is being dumped on open grounds or being burned, who is actually monitoring it? Who is actually overseeing it. So this is something that we even today feel that there is inadequate regulatory capacity, inability to handle waste from households. I've talked about it, and spare capacity with the CBWTFs. So I think some of the data that has come to us, it does tell us that there is certain amount of spare capacity with the CBWTF, and unless these number of active cases go up very, very exponentially, perhaps by infrastructure, we should be able to handle the biomedical waste which is being generated from identified centers or identified agencies or healthcare systems that we have. But if it goes beyond these active cases, then we might be landing up in difficult situation. Worker safety, and I think that's why I left the PPE issue. This has been coming up as a huge issue. I think there has been a constant reminder to all of us that workers do not have a right kind of PPEs. And if you especially look up the municipal workers, they don't have the right kind of PPEs, and that is a serious concern. And especially if you go down in the order of hierarchy for the waste warriors or waste people who work on waste, I think lower down you go, you find that most of them are very inadequately clothed or inadequately equipped as far as the personal protective equipment goes. And some of this data will tell you as to what is the kind of infection that we're talking about. If you look at doctors, as per the very recent report as on 24th of August, 1096 doctors have been infected in the country, which is huge. I think the deaths are also phenomenal, quite significant in number. It's crossed, I think it's about 300, if I'm not wrong, it's around that much. So 14% of Kerala healthcare health workforce staff contracted COVID-19 due to inadequate or shortfall in PPEs. I think the Kerala person, Kerala person will be able to say this. Ambulance workers, improper handling of COVID-19 samples. So these are all worker safety issues. I think one issue that I like to highlight here at this point of time is that this is going to be another issue. It's about vaccine, that when the vaccine comes up and we're going to give vaccination to 130 crore people in this country, and even if you say that X percentage will get this, and if you have to give them a booster dose, what is the quantity of waste that we're talking about? Are we really prepared for it? Do we have the necessary wherewithal to deal with this kind of waste that we're going to generate? So I think it's time for us to start talking about how do we prepare for this kind of a waste generation, which is going to be highly infectious. What do we do about it? So I think this is my last slide. So need for comprehensive data on biomedical waste generation and disposal, because this is where the lessons learned are going to be, and this is where you can improve upon it. So if you don't capture the data well now, we will not be able to take the right kind of decisions. Assess infrastructure inadequacy across the country. Where is the problem in infrastructure? Awareness on waste treatment options. How are we informed about treatment options? How good is it? Are we using the right kind of treatment options? Is it adequacy point of view, or are we going for an overkill? Improve compliance on biomedical waste management. Guidelines and SOPs for pandemic preparation and the training which is required to be associated with it, and advanced planning for vaccine waste. So that's all I have to say. Thank you very much.